First and foremost, I'd like to thank all of you for coming to this emergency meeting of world leaders to discuss a most urgent issue. Now, as many of you know, there's a new disease called Niemann-Pick type C. We have 500 confirmed cases so far. And in order to hopefully dismantle this disease, we gathered two of the finest researchers in the world to hopefully gather data to help us destroy it. Scientists?
Thank you, Mr. President. And hello, everyone. I'm Reggie Myles. I'm currently working with Dr. Erickson, Raj Patel, and my colleague who is here with me today.
Hi, I'm Yazmin Almazan.
What do you got?
So as you stated earlier, and as many of you know, the disease that we're studying is Niemann-Pick C. It's an autosomal recessive lysosomal storage disease that causes an improper metabolism and storage of cholesterol.
Et nous savons ce qu'il fait. Mais qu'est-ce qu'il fait?
Niemann-Pick C, or NPC for short, has numerous symptoms. These symptoms can include enlarged spleen and liver due to high levels of cholesterol, loss of motor skills, neuronal inflammation, and jaundice. These symptoms are often fatal, and they can lead to other diseases like pneumonia. So, as a majority of my research, I've been studying the symptoms and how they affect the nervous system. And by running olfaction tests in the mice, specifically the AG or the GG mice, which are the mice affected by this disease, I am able to see how the disease puts a halt to the motor skills and has a cascade effect on other senses like smell. ¿Cuánto tiempo tiene el paciente hasta que está afectado y cómo está diagnosticado? NPC puede estar diagnosticada genéticamente, físicamente y a veces cuando la mamá está embarazada. El más común identificador de NPC es parálisis de mirada vertical, y eso es cuando la paciente no puede ver para arriba y para abajo con sus ojos sin mover la cabeza.
Well, what does this look like on the inside? How did this work on a molecular level?
Well, it's interesting that you would ask that, actually. As I stated earlier, the disease is autosomal, meaning that it's genetic. And if you zoom into the genetic sequencing of a patient, we found that it is mutation in the NPC1 or 2 gene that causes the disease, hence Niemann-Pick. The mutation affects the lysosome's ability to digest dysfunctional mitochondria. And without the balance of neural apoptosis and the generation of new neurons, the nervous system is then overloaded with the presence of dead cells. This activates the microglia, which then leads to the neuronal inflammation.
Well, if we know that inflammation is the problem, wouldn't a proper solution be to just administer anti-inflammatory medicines? Or you can bomb it. Yeah? Sounds more to me.
Well, no, it's not that simple, actually. It's not a person or a country, it's a disease. But that kind of leads me into my current study. As you know, microglia are sort of like white blood cells, but in our brains they're an immunoresponse. And we know that the neuronal inflammation is caused by activated microglia, which then release cytokines like TNF-alpha and CD14. The inflammation happens when the microglia release these devices and they overstimulate the neurons, leading to inflammation and eventual death of the neuron. And my current study is focused on finding whether or not the mutated NPC gene increases the expression of these pro-inflammatory devices. And we're doing this by means of the RT-PCR or real-time PCR. And this tracks in real time how many cycles it takes of the machine for these pro-inflammatory devices to reach a threshold or a certain number of expression.
Si lo hace, ¿podemos hacer cura?
Great question. Our study is ongoing, but because we know that each one of these inflammatory devices follows its own unique pathway, by figuring out whether or not this mutated NPC gene increases or decreases the expression of any of these devices, we can then begin to narrow our focus into that pathway and hopefully find some way to create something that can stop that and then hopefully stop the inflammation.
What is your overall goal? that you would like to achieve here?
The current goal of clinicians and researchers like myself is to find a way to delay the onset of the disease and significantly increase the length and quality of life of the patient.
Well, I hope you come to a good conclusion soon, because every day there are people suffering from this disease. And be sure to report back when you have something good.
I understand, sir, and we're working hard every day to hopefully find a way to alleviate the suffering of these NPC patients.